Hello everyone, today my group will presenting the background of Michael Jackson case, what happened on June 25, 2009, and what this incident became a significant example in forensic toxicology. Before we begin the presentation, I would like to introduce my group members. I am Muhammad Shakirin, presenting at Presenter 1, Presenter 2 is Ricky Ngong Anakko, and Presenter 3 is Muhammad Fitri Amin. Who is Michael Jackson and what happened? Michael Jackson was one of the most successful and influential performers in the world. However, behind the fame, he struggled with long-standing and severe insomnia. During the preparation for his comeback concert tour, that is it, he needed medical supervision to help him sleep. For this, he employed Dr. Cornell Murray as his personal physician. On June 25, 2009, Michael Jackson was found unresponsive in his home. After medical investigation, the cause of death was determined to be acute propofol intoxication, with benzodiazepine also contributing. This immediately raised question because propofol is not normal sleep medication, it is a powerful surgical anesthesia. The timeline of 25 June 2009. Here's a clear timeline of the event leading up to his death. Throughout the night, Jackson complained of extreme insomnia. Dr. Murray first tried to help him using benzodiazepines such as lorazepam and midazolam. These drugs typically cause sedation, but in Jackson cases, they are not effective that night. Because of benzodiazepines failed, Dr. Murray turned to the propofol, a drug usually only given in hospital with close monitoring. Jackson referred to it as his meal of anesthesia. After giving the propofol, Murray left Jackson alone in the room, which goes against standard medical practice because propofol can quickly depress breathing. When Murray returns, he found Jackson not breathing and unresponsive. He attempted CPR and called for assistance. Jackson was taken to UCLA Medical Center, but this is why this case is important to forensic toxicology. This case is extremely important in forensic toxicology for several reasons. First, the main drug involved, propofol, is not recreational drugs. It is a hospital-grade anesthetic that requires equipment like oxygen, cardiac monitors, and airway support. None of these were present in the room where Jackson was treated. Second, the toxicology report shows that polypharmacy Jackson had both propofol and benzodiazepine in his system. These drugs can be interacted and intensify each other's effect, especially their ability to slow breathing and suppress the central nervous system. Finally, this case highlighted major forensic challenges: how to interpret drug level after death, how to postmortem redistribution might challenge considerations, and how to determine whether the death was accidental, self-administered, or due negligence by his physician. To conclude my section, here are the three core forensic questions toxicologists had to answer during investigation. Number 1, what drugs were found in Michael Jackson's body? Number 2, what the concentration of this drug in his body and tissues? And number 3, were this concentration high enough to cause respiratory failure and lead to death? These questions guide the forensic interpretation and were essential in determining the cause and manner of death. That's end my part, thank you, and I will pass it to the next presenter.
Toxicology analysis identified several key substances. First, propofol was detected in central blood, peripheral blood, vitreous tumor, and liver samples. This indicates recent intravenous administration. Second, multiple benzodiazepines were found, including lorazepam, midazolam, and diazepam. These sedatives which depress the central nervous system. Third, lidocaine was detected. This most likely due to resuscitation effort or use during IV administration. Overall, the drug profile suggested deep sedation combined with anesthetic level of propofol. Propofol pharmacology. Propofol works by enhancing GABA receptor activity in the brain. This increases chloride ion flow into neurons and leading to central nervous system depression. At low doses, it causes mild sedation. At moderate doses, it produces deep sedation. And at high doses, it acts as a general anesthetic. However, without proper monitoring, propofol can quickly cause respiratory arrest, meaning the patient stops breathing. Although it has a short half-life, a single bolus dose can cause apnea within seconds if the airway is not supported. Toxicology interpretation challenges. Interpreting propofol level after that is challenging due to postmortem redistribution. After that, lipophilic drugs like propofol move from organs such as the liver and lungs into the bloodstream. This makes central blood concentration appear higher than they were before that. To improve accuracy, toxicologists compare central blood with peripheral blood, which is more stable. In this case, the distribution pattern and the presence of multiple sedatives still indicate a dangerously high level consistent with a fatal dose. Why this combination is lethal? The combination of drugs became lethal for four major reasons. First, propofol levels were high enough to induce deep anesthesia. Second, benzodiazepines already in the system and significantly increase respiratory depression. Third, there was no proper monitoring equipment such as pulse oximetry, oxygen supply, or ECG. And last but not least, there was no airway management, which is essential when administering propofol. These misleading safeguards are standard in operating rooms but were completely absent in this case. Based on toxicology investigative findings, the following sequence is most likely. First, propofol were administered intravenously while benzodiazepine was still active in the body. The combination caused rapid respiratory depression and followed by apnea. With no supplemental oxygen or airway support, blood oxygen level can drop quickly. This resulted in severe hypoxia and eventually caused cardiac arrest. The toxicology support that Michael Jackson died from respiratory depression and hypoxia caused by propofol combined with benzodiazepine.
For my section, we are going to step into the legal and ethical side of this case and see how the toxicology findings shape everything that follow. First, we will take a look at the medical examiner findings. The medical examiner conclude that Michael Jackson died from acute propofol intoxication with a contributory benzodiazepine effect that made the situation even more dangerous. But here's the key point. The manner of death was ruled homicide. Eventually, the focus of the investigation shifted towards Dr. Murray, not because Dr. Murray intended harm, but because the way he used these drugs created a deadly environment. If this case was ruled as homicide, what happened to Dr. Murray? What is his charge? In this case, Dr. Murray was charged with involuntary manslaughter, which is a charge that applies when someone dies due to another person's reckless or negligent actions. There are 4 negligent actions that we will take a look later. The first negligence action that he done was the propofol was given outside of a hospital. That alone is a major breach of medical standards. He claimed that he tried treating Michael Jackson's insomnia with other drugs and only administered the propofol after Jackson insists. But it is still a breach of medical standard as propofol is for anesthesia, not as a sleep aid, and should be properly given in a hospital or clinical setting with a close monitoring from anesthesiologists. The second one, there were no monitoring device during the injection of propofol. There were no oxygen tank and there were no pulse oximeter. Third, his response during the emergency was delayed and confusing. Instead of calling 911 immediately, he made a phone call to contact the Jackson's personal assistant first and urging him to come over. He even performed a CPR on a software which is ineffective. And lastly, there was almost no documentation for all of the medicine that he gave to Jackson. Even during the investigation, he couldn't clearly explain how much propofol was given or when did he give the propofol to Jackson. As a conclusion, based on all of this, the court found that Murray showed a gross negligence. He was convicted in 2011, sentenced to 4 years in prison, and lost his medical license. From a forensic toxicology perspective, this case teaches us even illegal hospital-grade drugs can become deadly when the standard of care is ignored, and how a toxicology report can decide the legal outcome of a global case. So, in the end, the Michael Jackson propofol case isn't just a celebrity tragedy, it's a powerful example of how science, medicine, and law intersect. Thank you very much.